Harry Nelson is an attorney, health law expert, and author on a book on opioids. He joins me now from Los Angeles. So, Harry, how big of an issue will the opioid epidemic play, if at all, in the 2020 elections?
You know, Elaine, it's a big issue in America right now, but I'm not sure that translates into a meaningful part of the electoral process. We've had a lot of talk in the Democratic presidential race about different plans, but also a lot of worry about how much it's going to cost. The big numbers being tossed around $100 billion over 10 years by some of the candidates are promising, but I'm not sure that it's actually an issue that's changing votes for American voters.
Would it be a more effective argument or issue to be discussed in local or state elections then?
100%. I'm a big believer that the solutions are going to come regionally. The issue looks different. The data shows different patterns in different parts of the country, different risks. And so a part of my argument in the United States of Opioids, my book, was we need to address it regionally and look at community partnership models, because this is a huge problem that's not ending anytime soon.
Certain regions, we saw some recent record lawsuits and settlements against these big drug makers. Is that going to do anything at all in this fight?
Look, all the resources we can get on this problem help. So people are saying numbers like $50 to $75 billion coming out of pharmaceuticals and distributors. So that money will help. We need to get more naloxone, the overdose reversal drug. We need to get more medication-assisted treatment out there. But I think the important thing to remember is it's not going to solve the problem. It's going to reduce the death toll, which is the most important thing, but we still have a big challenge of access to addiction treatment and drug use continuing across America.
Well, you mentioned it there, a lot of numbers being thrown out there, and you think of the money being spent, billions of dollars. Why is it that we haven't seen much movement when we talk about all the money that's involved here? What is happening to that money?
I think, the money, there is money being well spent on this crisis in the ways that I mentioned, but I think we're still, part of the problem is that America was slow to wake up to what a crisis this was, and we're still only now doing the research to figure out what actually works in terms of evidence-based treatment. And I think at the core, there's an underlying pain crisis in America. 50 million Americans complain chronic pain is a problem in their lives. And for young Americans, we have a culture in America of being uncomfortable. We're uncomfortable being uncomfortable. And just so much drug use and people migrating from drug to drug. So I think we're doing the research now, but we have a lot of work in the decades to come.
So that being said, Harry, there are other people around the world who are also in chronic pain. So what is the difference maker here? What is behind this culture of opioids in the United States that we're not really seeing anywhere else in the world?
So it's true, there is a problem elsewhere, although I would say the death toll is worse in the United States. The UN statistic from last year was the U.S. is 4% of the world population and 12.5% of the world's overdose deaths. So I think in some other advanced industrialized countries, we've seen more harm reduction approaches, more decriminalization, needle sharing, and overdose prevention or supervised consumption sites. That's part of the problem. And I think America has a unique culture of not wanting to say no to people when it comes to behaviors that other countries do a better job of creating a culture against dangerous behaviors.
Complicated issue for sure. We could talk for hours on this. Harry Nelson in Los Angeles, thank you so much.
Thanks so much for having me.